Hello students, today we will see regarding the aerosols, about the formulation of the aerosols, what are the uses of the aerosols, and what are the ingredients, what are the systems of aerosols. Basically, aerosols are nothing but are called as the pressurized package devices or pressurized system, because under the inside the aerosols we are adding all the contents with the high pressure. That's why they are called as the pressurized devices. So they can be defined as a system that depends on the power of compressed gas which is filled inside your container of the aerosol, or liquefied gas to expel the contents from the container. Or aerosols also can be defined as the product which containing the active ingredients in which may you have dissolved your drug, you may suspended your drug, or you may have emulsified your drug in a propellant or a mixture of solvent and the propellant, and which is intended for the oral, topical, or into the eye cavity, nose cavity, ear cavity, rectum cavity, as well as the vaginal purpose. So this is called as your aerosols. The aerosols was invented in 1942. It was developed in the form of insecticides. So it was used as an insecticide. Then another aerosol was developed into the 1950, which was as a pharmaceutical aerosols, and it was used for the topical administration purpose. Then again it was developed into the 1955 as a respiratory tract purpose. Then advantages of your aerosols. The advantages of aerosols are: first advantage is, when we are using the aerosols, it means it will bypass your drug from the first pass effect. What is the first pass effect? First pass effect means when your drug is taken to the oral cavity and then it reaches to the stomach, and at the stomach your drug will get metabolized. Some part of the drug will get wasted, or the drug will be metabolized. Due to the metabolized, your drug will not be useful. So the unmetabolized drug only will be effective. So in the case of your aerosols, as well as your topical dosage form, as well as your injections, or your other type of other than oral drugs, so your first pass effect will be avoided in case of your aerosols, because aerosols are not taken through the oral cavity. Aerosols are taken through the nasal cavity. They are applied on the skin, or they are applied onto any kind of your body cavity. That's why the drug will not be metabolized into the stomach. So by this way we can avoid the first pass effect or the metabolism of the drug. Another advantage of your aerosol is that the drug can be delivered directly to the affected part, as like as your topical drug delivery system. It means where your problem on the top, we can spray your drug onto the affected area. So directly your drug is reaches to the localized area, or local action is possible. So there is we can say quick action may be possible with the help of aerosols. Then sterility of your drug can be maintained while a dose is being dispensed. In case of your nasal aerosol, when you are taking your drug through your nasal cavity, so directly your drug is passes from container to the nasal cavity. It is not exposing to your environmental conditions. That's why we can say the sterility of your preparation is always maintained throughout your product utilization. Another advantage is that it is very easy and convenient for the application. For the topical purpose, just we have to press your button on your top of the aerosol container, and it will spread your drug on your skin. So no need to rub or no need to apply with your finger. So it is very easy to apply your drug in case of your topical as well as while taking through the nasal also, just you have to press your button and you will get the your required amount of the drug through the nasal cavity also, or onto your skin application purpose also. When we are applying your aerosols, just we have to press your upper top button of your aerosols. That's why it is very easy and very much convenient compared to your tablet, compared to your other type of intravenous type of dosage form. Then another advantage is that application of the medication is in the thin layer form. As your aerosol contain the propellant or the volatile materials and drug is completely dissolved, so it is in the form of solution, emulsion or the suspension. When it is sprayed, so it will give the very thin layer on your skin, or when it is applied to the your nasal cavity, so it is giving the thin layer of the drug in the form of spray into your mucosal membrane. So that's why, as like as ointment or as like as your topical powder, so the layer of the drug is very thin. Then another advantage is that it is having a very rapid response towards your drug, because your drug is already dissolved into your propellant, and when it is given through the nasal cavity, so it is directly reaches to your lungs. So that's why there is a rapid response or the quick action to your drug, as well as your systemic type of or the injections or your intramuscular injections or the intravenous injections. So the viability is always high after your intravenous injection. So the aerosol is having that kind of advantage. Then another advantage of your aerosol is that compared to your ointment, when we are applying your aerosols onto your skin, so there is no any kind of irritation is persist. Or when we are applying your powder, we have to rub that powder. Sometimes the particles of that powder may cause irritation to your skin, or there might be sometimes itching type of feeling may possible. But in case of aerosols, such kind of irritation is not possible, or such kind of irritation is eliminated. Now disadvantages of the aerosols. The advantage we have seen, the another part of the aerosol is, or the another side of that aerosol is the disadvantages. Disadvantages consist of, first disadvantage is that your aerosols are expensive, because for the preparation of your aerosols we require the high costly as well as volatile solvents, and another thing is the container and their content. So we require container, most probably we are using the steel container, as well as your upper system of your spraying nozzle, then deep tube. So this all the material is having a little bit costly. So this all the system is nothing but becomes very much expensive compared to your normal tablets, as well as the capsule, as well as your normal ointments, or your oral type of the delivery system. But it is having the versatile advantages. Then another disadvantage of aerosol is the flammability. As your aerosol is containing the highly volatile solvent, that is called as the propellant. So that propellants are highly volatile, so that's why they are highly flammable also. So in case of utilization of aerosol, sometimes there might be accidental chances are there that it may catch the flame. So while utilizing your aerosols, we should avoid your flames. So in the open area, we should apply your aerosols. So there should not be any kind of lamp near to while you are applying your aerosols. It means simply it can catch the fire. So flammability is possible. So this is the, you can say, dangerous disadvantage of aerosols. Then toxicity. Toxicity is another disadvantage of aerosols, as it may have the, you can say, while pressing your button of the aerosol container, sometimes you may not have the idea that how much time we should press your button. Sometimes extra dose may be delivered to the patient, or sometimes it may contain some volatile solvents or the propellant. So that propellant may cause the problem with your health. So this is the one type of dangerous type of disadvantage of the aerosol. Then another disadvantage is the explosive. your aerosol may become explosive or it may cause the explosion. When your aerosol is coming in contact with the heat or when there is a high temperature, so in that case already your aerosol is pressurized device. It means your propellant, which is highly volatile, already filled with the high pressure inside your container. So sometimes when it is getting heated, so it may cause the explosion. So blast may be possible because of your propellant. But most probably when we are using the steel container, so the explosiveness may be reduced. Or if you are not exposing your aerosol to the high temperature, then we can avoid the explosive or the explosion. Then some propellant like chlorofluorocarbon, this kind of chlorofluorocarbon type of propellant may cause the depletion of the ozone layer. It means when we have applied aerosols, that propellant may be come out from your container and it may reach to your environmental conditions. So suppose that the large amounts propellants are used by the people, so it may cause the large release of the chlorofluorocarbon and it may cause the depletion of the ozone layer. So it is not we can say suitable for the environmental conditions. So this is the another we can say dangerous type of disadvantage of the aerosols. So these are the we can say disadvantages of the aerosols. Now the components of the aerosols. Your aerosol is prepared or it is manufactured by using the different type of components. The first component of your aerosol is the propellant. Propellant is nothing but the one highly volatile liquid or sometimes gas type of material which is responsible for the development of pressure inside your container. So that propellant is responsible for developing the pressure and to remove your drug in the form of spray, and then only we can able to apply your spray. So this is the first component of your aerosol. Then another component of your aerosol is it's a container. So this container is also most important. Because of that container only, it is possible to give the desired spray pattern of your aerosol. Then valve and actuator. Valve and actuator are responsible to deliver your content from inside container to the outside. So that tube, valve and actuator are able to develop the spray pattern, or as per your requirement they can cause the foam also. So that valve and actuator are the third type of component of your aerosol. Then product concentrate. Product concentrate is nothing but your actual drug, that is nothing but we can say active ingredient of your aerosol. This drug is sometimes may be dissolved with your propellant, or it may be added with another type of solvent. Then your product concentrate or your drug plus propellant will be added inside your container, and then we have to fix your valve as well as the actuator, and then your total system will be called as the aerosol. So this is about the components of the aerosols: propellant, container, then valve and actuator along with your container, and then product concentrate is nothing but your active concentrate or the active drug. Now what are the propellants? Generally these propellants are responsible for developing the pressure inside your container because they are highly volatile. When we are filled inside your container, after your container will be bring inside the normal condition. At the normal condition or at the room temperature, inside your container, that propellant will try to become the vaporized, or it will develop the gas. So because of that, inside the container pressure will be increased. So this propellant is having the ability to always give the high pressure, and because of that pressure, when you are pressing the button of your aerosol container, it will deliver your product with the high pressure or in the form of spray. Types of propellants. The propellants are having the two types, that is liquefied gaseous propellant and compressed gaseous propellant. Basically these are all the liquids. When we are filling inside the propellant, they will be in the form of liquid, but half part of your container will be liquid and half part of that container will be in the form of gas. So that gas will cause the pressure inside your container. When you are expelling your container content, some amount of propellant and drug will be removed from your aerosol container, and whatever the propellant is remain inside your container, it will again develop into convert into the form of gas. So it will try to always convert into the gas inside the container. That's why your continuous pressure will be built up inside your container because of the presence of such kind of propellant. Now, what are the examples of your liquefied gas propellants? Liquefied gas propellants exist in the form of liquids under the high pressure. When we are filling that liquefied gas propellant inside your container, at that time we have to maintain the chilled condition as well as the high pressure. Because of that high pressure, while filling it may convert into the liquid state, and when it is reaches to your container, it will try to form the gas. So these liquefied gas propellants are very much useful for development of the pressure inside your container. See, this is the diagram I have shown you here. That is the your liquid volume is increased because of the presence of such kind of liquefied gas propellant, and some amount of that propellant is converted into the gas, into the pink color I have shown here, and that gas is always pressurizing your liquid, and this is the deep tube which is carrying your propellant plus active ingredient. So when we are pressing the upper button, your pressure will try to release from this your actuator or the orifice. Examples of such kind of propellant: chlorofluorocarbon. This is the one category. This kind of propellant are the choice of propellant for the particularly inhalation or nasal drug delivery purpose as well as the oral drug delivery purpose. Such kind of chlorofluorocarbons are having the versatile advantages. First advantage is that they are chemically inert in nature, they are not having the toxicity, as well as they are not flammable, then they are not having the explosiveness also. See, these are the most important advantages. If we are using the chlorofluorocarbons, then we can avoid or we can hide your most of disadvantages of your aerosol, which where we have previously seen. So chlorofluorocarbons are the choice of propellant for all type of manufacturer. Then disadvantages of chlorofluorocarbons. Chlorofluorocarbons are having the high cost, so they are expensive, and they are having the disadvantage that it may have the ability to deplete the ozone layer. So these are the chlorofluorocarbon disadvantages. Now examples of chlorofluorocarbons. Chlorofluorocarbons are having the number of derivatives. First derivative is the trichloromonofluoromethane. It is shortly called as the propellant 11. Then another example of your chlorofluorocarbon is the difluoromethane. Shortly it is called as the propellant 12. Then dichlorotetrafluoroethane. This is another example of chlorofluorocarbon. Then another category is the hydrocarbons. So this kind of hydrocarbons are used for the water-based aerosols for the specially topical use purpose. So advantages of hydrocarbons are they are not inexpensive. It means they are not costly. Then they are excellent solvents for most of the drugs. So most of drugs can be dissolved into such kind of propellants, and it does not cause the ozone layer depletion. Then disadvantages of hydrocarbons are they are inflammable, as well as they are may having the ability to cause the toxicity. Examples of hydrocarbons are propane, isobutane, and butane. So these are the examples of hydrocarbon propellants. Then another category is the hydrofluorocarbons and hydrochlorofluorocarbons. So these kind of propellants we are using. Generally, these kind of compounds break down into the atmosphere at the faster rate than your other kind of propellants, and they have the lower ozone destroying effect. The advantages of such kind of propellants are they are having the low inhalation toxicity, they are having the high chemical stability, they are having the high purity, and they are not having the ability to cause the depletion of the ozone layer. Then disadvantages is that they are having the poor solvents. It means very few drugs are having the solubility into the hydrofluorocarbons, as well as they are having the high cost. They are expensive. Examples of such kind of propellants are heptafluoropropane, tetrafluoroethane, then difluoroethane, chlorodiafluoromethane, and chlorodiafluoroethane. Then another type of propellant is the compressed gas propellants. Compressed gas propellant occupies the space above your aerosol container. Then when we are pressing your wall, they will open the gap and it will pushes the liquid out of the can, as like as your previous types of propellants. Examples are carbon dioxide, nitrous oxide, as well as the nitrogen. Such kind of your system will be there. This is the gas and this is the liquid. Because of the high pressure, some amount of gas is converted into the liquid. As you are pressing your button, some amount of liquid will be expelled from your container along with your drug, and whatever the space is become empty, that gas will be prepared immediately.